It's now the law, and it has a dramatic impact on all of our lives. The Affordable Care Act, often referred to as Obamacare, has transformed the way we get health insurance. The plan is complicated, the changes can be confusing, and they can be frustrating. It is certainly controversial. For some of you, costs have already gone up. For others, they went down. Welcome to our new healthcare landscape. Join us as we cut through the noise and get down to understanding healthcare. Hello, and welcome to Understanding Healthcare. I'm Paula Zahn. In 2010, the first baby boomers turned 64, an early sign that America's largest generation would soon be eligible for Medicare. There are 78 million of us born between the years of 1946 and 1964. And every day, 11,000 of us turn 50. And now we have the Affordable Care Act, which dramatically changes the way we get our health care. As a result, most of you were able to keep your plans, but some of you weren't. Regardless, understanding health insurance and Medicare isn't easy for any of us. So our goal on this program is to help you navigate this very complicated new terrain. First, we are going to walk you through some of the most significant changes under the Act. Then we'll focus on the ways it specifically affects those of us in the baby boom generation. But first, to help us start the discussion, let's hear from someone like you. Let's meet Enola, who recently learned just how important it is for her health care to keep pace with her health needs.
I am passionate about cooking healthily for my family, cooking from scratch, because that heals me from the inside. I'm passionate about knitting, quilting, activities which allow me to create gifts that I have made with love for all the people that I care about. A re-emergence of a health issue has made me realize that having quality health care is important, because I now need to see specialists more frequently than I had. And their tests are expensive, and I need to be able to have that care that I need. Just because a deterioration of my health makes me realize all the activities that I have been involved in and I took for granted. And now I realize how important they are to me in my life. It is important to stay informed, because legally healthcare coverage can change from 1 year to the next. And for me, I have to see more specialists now than I had before. And so staying abreast of those changes lets me know what specialists I can see and what things will be covered and not covered. From here on out in my life, it's important that I stay healthy, because I'm looking forward to my husband's retirement so that we can travel and do all the things that we have talked about, and as well as future grandchildren. I cherish life and I enjoy all of the activities in which I participate. And so I would not like to lose the ability to continue to do those things.
Thank you, Enola. We appreciate your sharing your story with us. What a great example of someone who is advocating for herself, and that kind of empowerment is a goal of this program. And with that, I would like to introduce you to two healthcare experts, James Furman and Dr. Mark Fendrick. James Furman is the president and CEO of the National Council on Aging, a nonprofit group representing older adults and the community organizations that serve them. Dr. Mark Fendrick is a professor of internal medicine and health management and policy at the University of Michigan. He is also director of the Center for Value-Based Insurance Design. It's great to have both of you with us. Welcome.
Thank you.
So nice to have the two of you with us.
Thank you.
So here it is, folks. 906 pages in all of the Affordable Care Act. About the only thing I think we can agree on is this changes healthcare. We're not going to debate whether this is a good thing or a bad thing. But I'm wondering, Jim, if you can tell us, as simply as you can, what this really does for us. What is its impact?
Well, summarizing 900 pages in 9 seconds, I would say the purpose.
I'll give you 11.
The purpose of the law is to make sure that more people qualify for insurance, can afford insurance, that the insurance they get covers more services such as prevention and mental health, and once they have coverage, that they can be assured that they'll be able to keep it even if they get sick.
Do you agree with that assessment?
Yeah, even at 900 pages, it's an imperfect statute. I think the addition of certain benefits, protections, and rights is an important step forward, but we still have a long way to go.